In this episode, we will get rid of headaches with the help of a flamethrower. Very often, headaches come from the tension of the trapezius and suboccipital muscles. Trigger points form there. These are pathological densifications that can be removed with special pressure on them. With you is Dr. Demchenko. Let's go. The phenomenon of these pathological contractions in muscles and where they shoot was dissected by Siemens and Travel in a small book on myofascial pain and dysfunction. There, every muscle and every knot in it is described and what symptoms they give. We will choose the four most classic trigger points that cause headaches. So let's go. The first point is the trapezius muscles. And it often occurs because we spend a lot of time sitting at the computer or on the mobile phone. Its location is at the transition from the neck to the shoulder on the back surface, right here. When you are looking for trigger points, use a foam roller as a probe. You press hard and deep. We're looking for a disease thickening, upon hitting which there will be not only local pain, but also the pain that bothers you will be reproduced. We are interested in such trigger points. So, first we palpate, and when you find a disease thickening, grip it in such a way as to create a high support and press hard on the point. Next, it's very important to maintain the pressure for a long time without changing the load. We will press for about a minute. But if you don't rely on time, but on feelings, then the following sensations should be. The first 10-15 seconds should be very painful, then after 15-20 seconds the pain should decrease and you should have a feeling as if you are pressing less on the point. But in fact, the pressure also through about 30-40 seconds you will feel a sharp decrease in disease and warming in this zone. This is exactly what we are striving for. What is this technology? This is ischemic compression. The thing is that in order to maintain a spasm, the muscle needs energy. In the midst of adenosine triphosphate molecules, and adenosine triphosphate molecules come with blood, if you squeeze the point well, then you stop the blood flow there and accordingly the energy supply. And the muscle is faced with a choice to die or relax. And in 100% of cases, it chooses the second option. So we press, wait for the first 15 seconds, wait for relaxation, and when everything has warmed up and relaxed, we wait another 20 seconds. That's about a minute to a minute and a half. That's how we maintain the pressure. The second point is located on the Pectoral-Clavicle-Scapular muscle. This is the muscle that we can find right here. It's very visible if you tilt your head back a little and press your head against your hand. And here you can see how well it's contoured. Somewhere in the middle of this muscle there might be a second trigger point that can give us strong shooting pain in the head. You might be able to find this point with your hand first. Once you've found it, make sure it has local tenderness or goes to the head. If it goes to the head, then take the Flowmaster sideways and press it to this point sideways. You don't need to apply such pressure, apply sideways pressure. You can also hold your head on the support so that the head and neck are relaxed. Hold the point exactly the same way as in the first case until full relaxation and warming up in this place. Don't overdo it. You won't pass the sleepy artery, the spinal artery. There should be no unpleasant sensations. But if suddenly you press something incorrectly and strongly forward from where the carotid artery passes, you may feel intense pulsation under the plaster. You won't lose consciousness. Nothing scary will happen. Just if you feel a pulse under the marker, place the pencil not like that, but more to the side. Nothing bad will happen. The next point, which often causes a headache, is located under the occiput. We palpate the occipital protuberance. It's the most protruding part of the skull downwards, right here. This is a bit behind the ear and we go a little down from it and closer to the spine. Approximately right here. You cross the flosser like this. Put your head on your other hand to relax your neck. Find this point. And when you've aimed well and found the most painful point, press it in such a way that the plaster brings the muscle to the mastoid bone. We don't move to the side of the neck, but to the side of the mastoid bone. Press and hold. The first 10 to 15 seconds of pain can be intense and may even escalate. It's very good if it gives off and mimics that pain that usually bothers you. In this way, we have covered the main points on the neck. There are also additional points on the trapezius muscle. Here we have the masseter muscle on the jaw, which also often has pain triggers that will affect headaches. To find them, also use a thumb approximately in the middle part of the muscle. Look for the most painful places, because when you find them, press and hold until relaxation and warming up. As the muscle fades, you might find multiple such points. These methods work very well if your headache starts at the back of the head, goes through the top and goes into the eye. Sometimes it can be in the form of a two-sided pain, sometimes in the form of a one-sided neck migraine. The thing is, all these trigger points are conditioned by the wrong position while working at the computer and using phones. Therefore, as a prevention of this problem, use a more correct sitting position at the workplace and spend less time on mobile phones. Perform this technique once a day for about a week. I very often use a very quick and effective method to relieve trigger points, which is called dry needling, where a Chinese needle is inserted into this muscle and the spasm is relieved very quickly and effectively. If this video gets 1,000 likes, we will specifically shoot a video for you with a patient with a headache, where I use dry needling for quick symptom relief.